Well, hello, everyone. Welcome and good afternoon, unless, of course, you live in Hawaii or Alaska. Nevertheless, welcome. And today we're going to have a presentation that was put together by Dr. Donovan. And we'll go through that in just a minute, but I just wanted to everybody welcome. And then I'm going to bring up the PowerPoint and start from there. At the end of the presentation, we will do our best to answer questions. My name is Daryl O'Sullivan, and I'm a board member of the Western Neuropathy Association. Although I'm not a physician, I have over 40 years of experience working in medicine. So I will do my best to help answer questions. Dr. Donovan would have been a perfect person to have answered, but he's just not available right now. So I think I'm going to go ahead and bring up the presentation and we'll get started. Okay. Okay, so we're going to be talking about neuropathy, and this presentation was put together by William Donovan MD. And like I said, Dr. Donovan, who is also the support group leader in Monterey, just not available to do the presentation, and it was very gracious of him to allow me the opportunity to present his presentation to you. So I'm very grateful for that. So Dr. Donovan received his bachelor's degree with honors in psychology at the University of California. And then he went on to get his medical degree and interned at Kaiser Foundation Hospital in California. After he finished his internship, he moved and joined the Army Medical Corps, where he was acting chief of neuropsychiatry at the U.S. Army Hospital in Frankfurt, Germany. After he got out of the Army, he continued his medical practice and research at Harvard Medical School, and later moved to Texas, where he started work in San Antonio, Texas in 1971 as a psychiatrist at the Diagnostic Clinic of San Antonio. And he worked there for over 30 years. He returned to California for his retirement, where he started his education. And we are all very grateful and very lucky to have his expertise in Western Neuropathy Association, where he is a columnist for the Neuropathy Hope newsletter, leads the Monterey support group, as I mentioned, in monthly virtual meetings, and is also, like many of us, sufferer of peripheral neuropathy. So in today's presentation, we're going to be talking about neuropathy as more than just one kind of disease, but multiple types of symptoms and multiple types of diseases and subdiseases and syndromes. So we're going to talk about, we're going to cover preferences, we're going to cover symptoms, we're going to cover causes, preventions and mitigations, evaluations on how some of these diseases and conditions are evaluated, how some of them are treated, and also at the very end, we'll do some reference information that will hopefully give you some ideas on how you can also do some research for yourselves. So let's go on to talk about some definitions and some preferences. First off, I want pathos is a word derived from Greek, and it means suffering or disease. So obviously, neuropathy is a big group of diseases. Nociceptive is a type of pain that's caused by damage to body tissues. And oftentimes is a pain that feels sharp, aching, and throbbing. And so many of the neuropathy kinds of diseases and symptoms have this type of pain overarching everything else. In terms of preference, and I'm mostly going to focus on the United States, 7% of all Medicare patients have a first or second diagnosis of neuropathy of some type. That means 20 million Americans suffer from some form of neuropathy. And it can be anything from the beginning to a little bit of the symptoms to very aggravated, very extreme, and very painful types of symptoms. This also really boils down to, in terms of the latest information, in this probably is increasing with time because we're all getting living a little longer, that 30% of those over 80 have some form of neuropathy. Some of them may not even realize they have this particular syndrome or group of some of the diseases. So let's talk a little bit about some of the symptoms that relate to neuropathy. So sensory, here's some of the sensory symptoms that are numbness, hypersensitivity, allodynia. And these really can be put into a group called pain. That's sore, pressure, stabbing, pinching, and stinging kinds of pain. Allodynia is one where you're pressure sensitive, very sensitive to touching things. I know that I suffer from some of that, from touching, especially my feet. When I hit my foot on something and I don't have my shoes on, it really hurts a lot more than ever did when I was a lot younger. Paresthesia, tingling, burning, shocks, and itching. Many of us have suffered through some of those. Balance problems, position sense. Sometimes we're not sure, even in walking, whether we've got our foot down in the right place. So ataxia and gait can also be a symptom of neuropathy. Autonomic symptoms can include some heart issues, circulatory problems, bladder dysfunction, gut dysfunction, and gastrointestinal problems, and also sexual dysfunction. Motor symptoms relate to weakness, atrophy, muscle atrophy, particularly cramping. And boy, I tell you, I certainly suffer from a lot of cramping in my feet, and I imagine that many of you do too. Twitching, jerking, and tightness, and that can be really tight, like you're really ready to cramp, but you really can't. You're not going to yet. Loss of functions. And sometimes functions aren't always what we think they are. Fear of disability is a loss of function because it causes a lot of mental anguish. Progression of the disease, and most of us have felt the progression of the disease over years. And of course, all of this can also result in depression, from anything from simple depression to very deep and problematic depression. Causal classification by diagnosis is another important way to look at some of the diseases that neuropathy represents. Hereditary, for example, is CMT, is Charcot-Marie-Tooth disease, celiac disease, which is a gastrointestinal problem in terms of being able to deal with different types of protein, as well as components of things like wheat and flour and things like that. Porphyria is a disease that relates also to blood. Mechanical diagnosis or causes such as trauma, carpal tunnel, tumors, and disc problems can also be causes of neuropathy. Metabolic, which most of us have heard many, many times about. Diabetes, of course, is the one big one, but it's not the only one by any means. 50% of people who suffer from diabetes generally have some form of neuropathy. It may not be peripheral, but it can and most likely would be peripheral. Thyroid disease can also have problems related to, that can show up in neuropathies, uremias, and amyloid disease. Infectious diseases such as HIV, shingles, and Lyme and leprosy can also result in neuropathies. Again, depending on the severity, it can go anywhere from something relatively easily to deal with to very severe. Toxic, this is one we've heard a lot more about over time, particularly when it comes to chemotherapy. So chemotherapy is a big cause of neuropathies. Sometimes it's able to go away, and sometimes and many times it is not, because chemotherapy is pretty nasty poisons that are put into your system to kill off cancerous cells. Alcoholism can be a cause of neuropathy, and medications. I'm going to show you some medications in a few minutes that'll just blow you away. Heavy metals. Agent Orange, people who have been in the military and who suffered through and have been contaminated by Agent Orange have sometimes some very severe neuropathies. And Sequitera, which is a heavy metal poisoning caused by eating fish that are contaminated with heavy metals. So another one is malignancy. Paraneoplastic malignancies are a sort of a group of malignancies that are relatively uncommon, and they develop in people who have cancer, and they can affect the skin and the blood and the joints. And so that's another area that can also be a result of indirectly of causing neuropathy. Multiple myeloma is also a cancer and also causes severe problems relative to proteins. Sarcoidosis is also another one, which also has a sort of a little symptom, syndrome of various types of cancers and neoplastic growths that cause sarcoidosis. Autoimmune is Guillain-Barré and CIDP, which is chronic inflammatory demyelinating radical low neuropathy, excuse me for tongue twister, as well as Sjögren's. And Sjögren's is also a group of sort of miscellaneous types of, and very rare types of growths that are somewhat cancerous, but also caused because of autoimmune disease. Vitamin D deficiencies such as B1, B3, B6, B12, folic acid, and vitamin E. The folic acid deficiency is pretty limited nowadays because, you know, many of the things that you buy that have to do with, you know, breads are already required to have folic acid added to them, and that's federal laws. And of course, we have another big area called idiopathic, which really means that we have no idea what's causing it. 30% of neuropathies are caused by idiopathic. Medications known to cause neuropathy. Now, I'm not going to read all these medications by any means, but I just wanted you to see, and actually I didn't, but Dr. Donovan wanted you to see all of the different kinds of medications. Many of these medications, many of us have taken over the years. Some of us take them even right now. And these can add to or even eventually cause neuropathies. Again, the severity is very variable in terms of from a very simple to fairly mundane kind of a neuropathy to something that is very severe and very debilitating. But look at all these different medicines, and if you're on any of them, you might want to just put a little note to yourself. And the next time you see your physician, talk to your physician about a little bit about how is this affecting you, like metformin if you're a diabetic, you know, or a nitrofurantoin, which, you know, people who have chronic urinary tract infections often take that particular drug. So there's all kinds of different things in here that could potentially cause that, and that many of us take. Gentamicin as an antibiotic, as an example. So there's a lot of different ones. Anyway, again, this is going to be available on our website under the recorded in our YouTube videos. And so you'll be able to come back and take a look at this list just in case you miss anything. Excuse me. And I'll be able to focus a little more time on it. Prevention and mitigation. To help prevent and to help mitigate some of the symptoms that we have with neuropathies. You can avoid toxins such as alcohol and tobacco and heavy metals. Don't smoke and don't drink, particularly in excess. Minimize your exposures to infectious diseases such as HIV. Safe sex and clean needles. And clean needles doesn't, and safe sex isn't all about HIV. It's also about hepatitis B and a number of other bloodborne, you know, infections. So this is very important that we keep all these things in mind. If you haven't had a shingles vaccine, it's probably a great idea because the shingles virus can also cause severe problems related to neuropathies, and those neuropathies can be extremely painful. Sufficient amount of B12 vitamins. Make sure you take your B12 vitamins, and that you can actually get your doctor to check for B12 and things like that, and other B vitamins as well. As long as you have a good diet and things, you're probably less likely to have these kind of problems, but it's still a good idea at one time, and you know, every so often to have a few tests like that. Minimize saturated and maximize unsaturated fats. That just helps the whole system work a little bit better. And one of the things that Dr. Donovan recommends is the alpha lipoic acid at 600 milligrams plus acetyl L-carnitine at 1,000 milligrams. That's per day. So those things are designed to help mitigate and to prevent you know, the progression of the diseases as well. So in evaluating for a neuropathy or neuropathy diagnosis, your doctor will want to do a history and physical. These are standard for almost any kind of diagnosis. Things that are included in these evaluations are blood work, for example, the CBC, which is a complete blood count. Chemical profiles usually have to do with enzymes and other types of elements in the system, such as sodium, potassium, carbon dioxide, blood urea, nitrogen, creatinine, all these different types of analysis to check out various how well your organs are working and whether you're having any problems with any particular one of them. Hemoglobin A1C is a measure of your long-term glucose. It usually measures how well your glucose is doing in about every 90 days or so. TSH is thyroid stimulating hormone, and also that evaluates your hormone functions, which if you remember back before, we talked about your thyroid problems. And so TSH is a hormone that relates to your thyroid. Vitamin B12 is very important, and we've talked a little bit about that. Also, the serum protein electrophoresis with immunofixation is something that would be done for multiple myeloma, as well as other kinds of protein malfunctions. Heavy metals are usually something that's, you didn't anticipate or taking on. Most of it's because of food and other contaminants, but those are really important and can severely cause many very difficult neuropathies. Some of them can be, some of them you can recuperate from, and some of them you cannot. Neurology evaluations. In other words, a different kind of evaluation might be needed for non-length dependent, and that has to do with the length of the nerve fibers. And asymmetrical has to do with one side of your body versus another, instead of being bisymmetrical or having it on both sides. Treatment for neuropathies can include a lot of different things, and we're going to talk a little bit about treat the cause if identified, if you even have the cause, and many of us don't know what the cause is, and some of us may never know what the cause is. Some of it may be hereditary, some of it may just be us getting older and our body changing a little bit, and those are not significant things that can be diagnosed other than by age. Make sure that you work with your physician and understand that your physician is going to have to use some trial and error when adjusting your medications. It's not going to be, well, just take 2 pills and call me in the morning. Physicals, I think it's really important that we all do exercises, and exercise does help. I can tell you, I walked multiple miles a day, and it has helped my peripheral neuropathy enormously. Physical therapy is important. Balance training is important, and occupational therapy can also be very helpful. And I tell you, shoes, good fitting, good solid shoes are also really important, especially for peripheral neuropathy and for gait and for balance. Mild analgesics such as Tylenol, acetaminophen, NSAIDs that might be like Advil, those type of medications, and Tramadol. Those are all good for certain types of pain, mostly having to do with muscle pain. Nerve blocks such as anesthetics and corticosteroids have been used. Not that used that often, but they have been. Psychotherapy also is something that is important, and we don't always put enough support or understanding and participation in rehabilitation and support groups. And obviously we understand support groups since we're all here working with Western Neuropathy Association. And then you have the SNRIs, which I'm going to see if I can tell you what they are. Serotonin and non-epinephrine reuptake inhibitors. Isn't that a mouthful? Anyway, Cymbalta, Effexor, Wellbutrin, those are typical examples of the SNRIs. Also sleep medication, nortriptyline, trazodone, and Ambien. Nortriptyline does have some memory issues, so keep that in mind and talk with your doctor about that particular medication. Trazodone has very few side effects. And Ambien has a lot of information out there about people sleepwalking. Anti-seizures medications such as Lyrica or pregabalin, Neurontin or gabapentin, which I take all kinds of gabapentin and have for years, and it really has helped enormously. Topical types of drugs such as capsaicin at 8% and lidocaine patches. There's also a lidocaine ointment or a cream that you can now use that you can buy over the counter. Strong opioids. And of course, every one of these are something that relates back to the opioid crisis and can still be used, but needs to be done under very careful circumstances and working very closely with your physician. So Vicodin and oxycodone and methadone and morphine and of course fentanyl is extremely powerful. So again, these things, please don't do anything with these without working with your physician very carefully. And again, there's immune globulin, which is for very specific types of neuropathies. Alternative and complementary therapy. Dr. Donovan identified things like acupuncture, biofeedback, relaxation training. I mean, I think, sometimes when I'm laying in bed and I'm trying to go to sleep, my feet are driving me crazy. I do my very best to do some biofeedback and relaxation kinds of things. And sometimes it helps. I just need to do it more. And we probably all need to learn how to do it more. Transcranial magnetism. It's a relatively new therapy. And one of the interesting things about that therapy that's not listed here, though, is that it really helps with some of the severe headaches that people have. Topicals such as Neurogen, anesthetics like menthol, methyl salicylate, camphor, Bengay Ultra, Biofreeze, H-Wave, E-Stim, and Scrambler. These are all alternative types of therapies. And then you have things like Botox, which is a therapy that's used for all kinds of different things, including nerve problems. Omega-3 fatty acids or fish oil, agmatin and benfentin. Those are also good or potentially good therapies. Herbs, some people take sativa or turmeric. And so those also can be helpful. None of these necessarily work for everyone. I know the last one is cannabinoids or marijuana versus the THC component of marijuana. And again, that's all still something very, and you hear a lot about and has its good and its bad sides. Almost every one of them do, as well as, like I mentioned, that some of them work for one person and they don't work for another. So you sort of have to work with each of them and see how it affects you. Now we get back to finally to the area where we talk about some resources that could be helpful to you. And many of us have used some of these resources. So Dr. Donovan recommends some of these books, Norman Latov, Peripheral Neuropathy, When the Numbness, Weakness, and Pain Won't Stop. And we all know that that's the way it is 24 hours a day. Other authors such as Mims Cushing and Jared said, Janice Weissman. So one of the things Dr. Donovan also recommends is that you talk about these books with your doctor, as well as and make a list of your symptoms, when they occur, what happens, and how difficult it might be at different times of the day, particularly in the evenings and when you're trying to sleep. Some other resources that you can use and that I highly recommend, and that I have often, when talking to people who are suffering from peripheral neuropathy, who are just thinking about joining the organization, I send them to our website at pnhelp.org, and I ask them to take a look at the medical literature. I ask them to take a look at the YouTube videos, and to just think about some of the information that's provided that might be helpful. Another site that's probably sort of unknown to you might be this NCBI, which is the National Center for Biotech Information. And I think it's really worth taking a look at and seeing whether there's information there that might be of help. I think we've gone through everything that Dr. Donovan had put together, and I think it was really a good presentation that he was trying to make sure you all had an opportunity to hear about and to get sort of a global picture and to realize that neuropathy is a giant group of syndromes and diseases, and that it can be very specific to peripheral, or it can be very specific to a chemotherapy event, and so on. But I just wanted to say again, thank you to Dr. Donovan for putting this all together and for allowing me the opportunity to present it to you. So I think at this point, I think we'll open up the question and answers, and there's a few of us that are, at least a couple of us, that are available to try to answer your questions. So I think we'll go from there. So Lindsay or Glenn, anybody seeing anything that you'd like to bring up in questions?
I think actually we have a couple in the chat, but more in the Q&A section.
Okay.
So, which one do you think we should go after first?
Let me just let's sort of go one at a time here, and then I'll sort of answer as much as I can, and then we'll go from there. Does that sound all right?
Yeah.
And then we have a raised hand up here also. So let's just answer. Kathy Clemens asked, can you get a copy of the presentation, particularly interested in the meds? Actually, yes. That presentation would be available on our website through the YouTube videos that we maintain. All the webinars are recorded and on the website, and you will be able to go through the presentation that way. And the next one is that I mentioned. This is being, I did mention that. And metformin can cause neuropathy. My husband and I are both diabetic and take it twice a day. This keeps telling me it has it's bad for us both. It's really interesting because, you can't take all of the good and the bad of a medication without realizing that it has good, I should say it has good and bad. One of the things that is really interesting about metformin that you may not know about is being now looked at as a life elongation drug. I know that sounds a little strange, but it's actually a big piece of research going on. But make sure you talk with your doctor about all that. So let's see here. Wondering if I'm experiencing neuropathy in my hands and nose. I assume that might be related to the question above about the metformin. Again, I really recommend going and talking to your doctor.
I will just mention, one thing. It's certainly possible to experience neuropathy in places other than your hands and your feet. I'm definitely one of those people who's had a full body presentation, basically from the tips of the toes to the top of my head with no part unscathed. It's more typical, particularly with longer term chronic neuropathies, for it to have a dying back progression where it starts in the areas that are most extreme from the center of circulation and then progress toward the center. But that's not the only presentation. Certainly there are people who've had full body from the get-go. So
yeah. So let's see. Wonderful detailed information that you zoomed through so quickly. I was trying to be really slow, but everybody always does that. It's really funny because I tell myself, now let's do this nice and slow. But remember, you will be able to see the PowerPoint and look at it at your leisure through the website, which I think will be help. So let's see, possibly given the Western neuropathy. Yeah, it's definitely going to be on the website. Okay, so why don't we go then to Q&A now, or was that quick Q&A or not? Okay, so I guess
that was chat.
That was Q&A. So let's see, we had a raised hand. Did we get that resolved or not?
Yeah, he added a question in the Q&A. So if you go through those.
Oh, okay.
It looks
so
like he's in there.
We were at where okay, so let's see.
We were in the chat before.
So is that Richard? What about neuropathy that only occurs when you're sleeping? When sleeping pain in the shins, like being hit and sledgehammer getting worse and longer. Oh my! And there are connections between peripheral neuropathy and restless leg. I'm sure there are. But again, I really think that it's important that you list all these types of symptoms when you see your doctor. And if you can find yourself a neuromuscular neurologist, it would really be beneficial and more specific towards neuropathy problems than just a general neurologist, because many neurologists, they specialize in things like Parkinson's or other types of diseases, as well as, and some of them may not specialize at all in neuropathies.
I'll also say as far as Richard's questions goes, there may well be some connection. The research is pretty equanimous about that at this point. It turns out, though, that I would say that anybody with symptoms like that should also be checked out for peripheral artery disease. Simply because that, that type of presentation, while it could be a neuropathic presentation, it could be a circulatory one as well. And it could be very, very hard to just tell just from the symptomology.
Yeah, no, I agree. Now, I don't know how to answer. I don't know what LR our lipoic acid is.
I will talk about that if you want.
Oh, okay. Please do.
Okay. Obviously, in the presentation, Dr. Donovan's presentation, they talked about alpha lipoic acid, which is absolutely used as a treatment for neuropathy. In Europe, in fact, it's a prescription thing. In the United States and Canada, you can actually get it as a supplement. The R-lipoic acid is the next generation of this. It turns out that chemically speaking, lipoic acid comes in two isomers, basically two different forms. There's a left-hand one and a right-hand one. The right hand is R. It seems that that is the one that is most active in the body. So basically a batch of supplemental chemists came up with removing the inactive part and just putting R-lipoic into that next generation of supplements. It does tend to be milligram for milligram more effective. Usually the transference and ratio that's given is about 6:1 to 10:1. So somebody who was taking 600 milligrams of alpha lipoic a day could try taking somewhere between, say, 60 and 100 of R-lipoic to get roughly the same effect. Keeping in mind, obviously, that your mileage varies and not everything works for everyone, but it's basically the next generation of lipoic acid. Some people prefer it because lipoic acid is an acid, and people taking a lot of alpha lipoic have sometimes reported gastrointestinal symptoms. With our lipoic, that tends to be minimized.
Okay, thank you. So Catherine asks, how often should you have blood work done to compare your levels? Every 5 years, 10 years? Is this going to help our treatment and or diagnosis? Well, your doctor's going to basically be doing many of the blood evaluations on a regular basis, whether you're suffering from neuropathy or not, because they really are good monitoring processes for sort of a stepping off towards whatever kind of diagnosis or therapy the doctor might feel you need. So yeah, there's going to be, I know, for example, that most of the time my doctor mostly does a lot of these different kinds of tests once a year. And that's probably true with most doctors nowadays. Now, again, though, they're not necessarily related only to neuropathy by any means. They're really pretty generic. And at least it gives them a way to sort of point in one particular direction or not. Hope that answered the question. So Richard, any use of carbamazepine? My doctor just prescribed it. Carbamazepine is it's a lot like a tricyclic antidepressant, which is helps with sleep more than anything else. Again, the thing you have to balance is and looking at the medication, how well it works for you versus what the side effects or the negatives can be. Some of the medications, particularly like, for example, the tricyclic antidepressants, and they can have some very unusual memory problems. In other words, you can lose memory related to it. Kevin Grimes, I began ketamine infusions on Wednesday. Curious if anyone has tried that. Have Guillain-Barré syndrome. Wow, ketamine infusions. That's really interesting.
Yeah, I'm curious as to what they would prescribe that for, because obviously with Guillain-Barré, they usually recommend an immune modulator.
Exactly.
They'll do IVIG, intravenous immunoglobulin, or plasmapheresis to try and clear the blood of rogue antibodies. Ketamine, I would assume that ketamine is being done because of sensory pain or discomfort. And Kevin, if you want to type in on there and tell us why they're doing that, it'd be interesting to find out.
Because it is an opioid. Yeah. So Robert asked, I have venous stasis. Would that contribute to my neuropathy? Yeah, I think it might.
Yeah. Very much so.
Yeah. So exercise, if it can be helped by exercise, and I'm not sure that it can, but if it can be helped by a little exercise, walking is a fantastic exercise that is not overly extraneous, and it really helps the circulation. Let's see, where are we at? Deepak, I have burning in my left toe. How can I get rid of that? I wonder if it's bilateral or just your left side. So that's something that may require a different, more of a evaluation if it's only one side, because oftentimes neuropathies occur on both sides, but not necessarily. You need to talk with your doctor. And, you know, I know that I've gone through acupuncture, and I can tell you that acupuncture helped me reduce the coldness in my feet, or the concept of coldness, but it did not make it go away. So, I mean, I don't know that there's a particular management of it other than just keep working at it and definitely talk to your doctor and maybe get a little more evaluation, particularly if it's only on one side. So Kevin said pain management. And yeah, I definitely agree with it. It would be pain management. So Catherine also put down, knowing the cause of neuropathy help with treatment, treating the symptoms. And if it seems everybody has the same symptoms regardless of the cause. Well, yeah, it definitely knowing the cause of the neuropathy can help with some of the symptoms and treatment. And everybody has all kinds of different types of symptoms. They don't all have the same symptoms at all. Some people will have tingling and sharp pain, and other people will have numbness and other. I mean, it's quite a variety of different things. There's many neuropathies, be it the kind of neuropathies that many of us suffer from, to severe neuropathies, even like Parkinson's disease, have different types of symptoms per person. Yolanda, I wake up with foot pain. Why? Oh, that's a big, giant, open-ended question.
Yes, we wish we knew why we woke up with foot pain.
Yeah, so I you really should write down when it happens, what kind of pain you're feeling, and talk with your doctor about it. That's the best answer I can give you. Anybody else? Anybody have it? Let's see, there's one, let's more. I think that's all I've got for the Q&A right now, is that last one. Okay. Glenn, any other comments?
Basically, you know, what I tell people, by the way, just so you know, I'm Glenn Robotsky. I'm also part of the board of directors at Western Neuropathy Association. Often has been characterized as one of the people who's done an enormous amount of individual research on this, because he had a very, very unusual presentation of neuropathy. Mine, as I said, was acute and body-wide. I basically tell people that there are, at this point and counting, more than 250 specific conditions that cause or lead to neuropathy, which is a tremendous number. There's a good and a bad aspect to this. We're finding more and more about it every day. In fact, the Human Genome Project has revealed a lot of hereditary neuropathies, which you know, people did not know about. Sometimes they had recollection. Grandma always said her feet hurt. We didn't know why. And it turns out there are a number of genetic conditions that lead to nerve degeneration. But as with many situations, neurological, our knowledge of what can cause neuropathy is well ahead of being able to treat it and or cure it. There are neuropathies that are reversible, okay? Certain causes, if they're toxic, if they're autoimmune, if they're chemotherapeutic, sometimes stopping the chemotherapy will result in improvement. But yes, for many people, perhaps most, that's not the case yet. They certainly wind up in a situation where they're living with it and trying to adapt and cope with it. The idea, I guess, is that you want to be with a physician that you trust, whether it's a neurologist or not. There's certain information, you know, obviously with the Western Neuropathy Association website that it's very good to have. If you remember, this month's newsletter has some other sites online, which I wrote and recommend very, very much people become familiar with in order they can discuss it with their physicians as well. And it looks like we have a couple of other questions now.
Yeah, so Richard is asking, you mentioned the checking of peripheral artery disease and seeing a neuromuscular neurologist. When you are seeing your primary care doctor and neurologist, how do you ask for that? Simply ask your, first
just
off,
that way.
Just ask your primary care physician that you want to see a neurologist, and in particular, you would like to see a neuromuscular a neurologist. Now, if you're senior neurologist, you should ask what his specialties are and whether he has good working knowledge of neuromuscular conditions.
And-
And it's just a matter of interacting with them, and, not being just, let you be a partner in your care. This one's for Glenn. The next one is Kevin.
Yeah, Kevin was the one who was talking about being diagnosed with Guillain-Barré.
Yeah.
Okay. You see, again, it's like, I was asking him, I actually typed him a little message asking him if any of his physicians had suggested any sort of immune modulating therapies. Certainly Guillain-Barré syndrome, or its longer lasting and more chronic form, which is chronic inflammatory demyelinating polyneuropathy at CIDP that Darryl was talking about before. These are neuropathic conditions where there are treatments. Now, the treatments are expensive. They tend to be fairly short in duration. People often have to do them over and over again for life. But for many people, they do provide some semblance of normality. I'm taking from what Kevin's saying that he either hasn't gotten those treatments or he's gotten them and they didn't work very well. And obviously, Kevin, if you want, I'm very open about this. I'm going to put into the chat what my email is. People often don't want to discuss this, often, in a more public forum. But anybody who wants to grab a hold of me and tell me about what happened, and so I can ask questions and stuff, I'll put that in. Somebody else here is asking about contact information as well.
Yeah.
I absolutely field this stuff just through my own hard-won experience, and I certainly can refer you to other medical sites and things of that nature too, if you'd like. And Barbara's asking about nutritional effects.
Well, celiac disease by itself means you have to be careful what you're eating. So that's one of them. Obviously, you want to make sure you have plenty of the appropriate vitamins, and appropriate eating relates to diabetes, obviously. So there's a lot of different potential nutritional, but as far as any particular nutritional thing that's going to relate to everything in general, just good nutrition is the best thing you can do.
Yeah. I will also say, by the way, one of the jokes over at the Cornell Weill Center for Peripheral Neuropathy, which is where I've been followed forever now, is that they often say that even if you're not diabetic, if you have neuropathy, you should treat yourself as if you are. Basically, watch that sugar intake. Sugar is apparently not healthy for nerves, whether it was originally caused by diabetes or not. And basically try and keep one sugar intake and one hemoglobin A1C in a nice normal range.
Yeah, exactly. And that should be something that your doctor is monitoring, your blood sugar. And if he sees that your blood sugar is a little elevated, they might actually ask you to have hemoglobin A1C done about every 3 months or so. So can we both talk more about metformin? I can tell you that my experience with metformin, because I have type 2 diabetes, is that it made me sick to my stomach and terrible nausea. And so I stopped taking it and went on to something else. That's about my extensive experience with it. So let's see, you said you're sharing your information with Richard. Bill has, what do you think of vibration platforms to help peripheral neuropathy? Again, I think that these things are mostly individual. Some people cannot handle the vibration. It actually makes things worse in terms of comfort. Other people seem to feel that it really helps them be able to manage their pain and the numbness and things. So I think it's a matter of trial and error. Here's an anonymous, not a QA, but a comment. I have idiopathic bilateral axonal PN, monthly IVIG infusions, downshifting, the stabbing, burning and buzzing and tingling, but it's still progressing up my leg and calf muscle atrophy and progressing fast. Any comment, Glenn?
It'd be interesting to find out if they might want to also perhaps add in something else with that in between infusions. I do know some Guillain-Barré and CID people who have gotten obviously the IVIG on a regular basis and also have sort of a steroid regimen that they do in between, basically for breakthrough types of symptoms. The other thing, of course, is the possibility, and this often depends upon your insurance, whether or not a different brand of IVIG might help a little bit more. Part of the reason I know from this is I'm also part of the GBS-CIDP Foundation group. They have their own foundation there. And people do report that there does seem for some people to be differences amongst IVIG brands.
Wow.
And now again, this is easier said than done. It may depend upon what your insurance will pay for, what your doctor feels comfortable with. But, it's certainly something you can suggest to physicians. One of the things I talk about is being your own best advocate. Don't assume that the doctor has suggested everything that is in the repertoire for these things. You can go in and suggest things. I mean, yes, doctors can say no, but you do want to be knowledgeable about these to the extent that you can be, and to be able to say, well, what if we tried this, or could you investigate this for me? It's something more people need to do with their physicians, especially with a condition like this.
So let's see. So we got, let's see. Virginia said that she's had many symptoms for many years. She's basically saying that her primary care physician won't refer her to a neurologist. You know what I would do? I'd get a new primary care physician.
Yeah. That sounds like a very problematic position in insurance situation.
Yeah. The other thing is, and you say it looks to me like you're a Kaiser member. Is that correct? If you're a Kaiser member and you're near Roseville, there is, in the Roseville Medical Center, Kaiser does have a neuromuscular neurologist. And what I've heard, he does very well. So I would really find yourself a new primary care physician, tell them what your symptoms are, tell them you really, what's it going to hurt to keep after them about getting you into a neurologist, and again, pushing for a neuromuscular one. Anyway, that's the best I think we can answer. I was told to cut back on B12. Excessive B12 is just damaging the PN to PN as deficiency is. Vitamin B12, like anything, even water, you can overdo. So, if you monitor it occasionally, like once a year, get a vitamin B12 evaluation, it'll tell you whether you're normal or not. And if you eat, mostly greens, like, a lot of good green food and meats and fishes, and you should have a good B12 volume without having to take a lot of excessive supplements.
Yeah. Now I'll talk about that a little bit as well from also my knowledge of the neurotalk people. Just make sure they're not telling you about B6 as opposed to B12, because B6, deficiency can cause neuropathy, but B6 intoxication, as they call it, can also cause neuropathy in people who have certain types of chemical genetic makeups. Generally, B12, even if you're outside, if you're taking supplements and you're outside the upper end of the range, generally that hasn't been implicated in neuropathic symptoms. There was a study done in Japan where they threw people 36,000 milligrams a day of B12, which is, by the way, about 18,000 times the recommended daily minimum dose, with apparently no bad side effects. B12 toxicity is very hard to achieve, but B6 toxicity can happen. So I would just double check that. Yeah. There are doctors like, and I've had this happen because I have taken B12 as a supplement. You come in, you get a blood test, you're high on the B12 reading, and they go, oh, cut back on the B12 without necessarily questioning whether this is actually harming you. Yeah. I mean, the reason I have a high B12 reading is I take a lot of B12. Yeah, but you do have to remember to mention this.
Yeah. Yeah. So Bill Dowd says that he's gotten off of giving up gluten, milk, processed foods, and sugars, and found that he's basically on a vegan kind of diet or a green kind of diet, and it's helped his peripheral neuropathy. I think that's definitely a positive thing. And again, how much you do this and how it affects you on an individual basis is really something you have to manage to some degree on your own. But it is a good thing to eat really good and well and healthy.
And Ela is asking about if anyone has MAG. Fairly rare, Ela. For those of you who don't know, MAG is myelin-associated glycoprotein. It's one of the components of myelin. And yes, there are definitely neuropathies where there are specific antibodies that attack that component. Often, by the way, it can be treated, but often people are reluctant to treat it because the treatment for that usually involves some of the heavier duty anti-cancer drugs, such as Rituxan. Basically, those are designed for blood cancers originally because they have immune modulating properties. They have been useful in certain types of autoantibody neuropathy, but it's definitely something, if you do have that, to talk about with a physician, but probably, again, a neuromuscular specialist. I don't know if the average general practitioner would know much about that.
Yeah, probably not. Yeah. Gary's talking about his exercise and how it's affected the blood flow. He feels like it's affected and reduced or slowed down the problems that he was having. And yes, he's absolutely right. Better blood flow will definitely help with regeneration, both of obviously of the tissue surrounding it, but also of nerve cells. So let's see, anything about EMG testing,
electromyography.
Yeah. Most neurologists, when they're doing neuromuscular type of things, are going to put you through this kind of testing. I always look at it as in a sort of a generic process, but it can help with certain conditions. Other than that, I don't know much about it. Glenn, you know any more about it?
Yeah, well, obviously, yes. When you come in with sensory symptoms that involve, say, loss of positional sense, a loss of vibrational touch, or with motor symptoms, a good neuromuscular specialist will do EMG testing. That's because EMG testing basically tests the responsivity of the larger myelinated nerves in the body. These are the ones that subsume those sensory functions and also motor functions as well. Myelinated nerves do not subsume the sensations of pain and temperature. Those are the small fibers, which are thinly myelinated or completely unmyelinated. You often hear them referred to as the C fibers. But yes, there are people out there for whom an EMG will be completely normal, and yet they'll have severe neuropathy. And usually what that points to is that their neuropathy is primarily small fiber in nature.
Mm-hmm. Mm-hmm. Bill Dowd, I think you just answered his question too.
Mm-hmm. Yeah, pretty much.
Robert Shannon, not so much a question, but experience with treatment. Let's see, abhor pharmaceuticals, which I've taken for other things and have caused more problems than solutions. Sometimes that's true. I do BEMER treatment a couple of times a week. Bioelectrical treatment helps with, anyway, I see CBD, okay. So using cannabinoids is a good thing, I think, in certain people and in certain situations. I've tried it myself on my feet in terms of ointment, and I don't know whether it was psychological. I thought it worked pretty good, but over time I seemed like it failed, and so I basically stopped taking it. Gabapentin did nothing when it took it for years. I take gabapentin, and without it, I'd be driving up the wall. So this gentleman's 85. And because of having knee problems, I can't walk. So I use a tricycle for better balance and bicycle for exercise. I think those are all fantastic things.
Yeah.
So all I can say is just keep it up, and you have to do what's best for you. And if things work for you that are non-traditional pharmaceutical things, then great. Then keep doing them, because if it helps, it helps.
And here's the question about cold laser helping PN. Yeah. This has been, I remember when I first went through my particular neuropathic attack back in 2003, and I was in the Cornell Center. There is definitely a back and forth with this. It becomes popular for a while, then sort of recedes into the background. There's been a little research on it. It may help nitric oxide balances within the circulatory system, which then helps the circulatory system bring nutrients and oxygen to nerves and get toxins out. But I definitely think that's your mileage may vary situation. Certainly some people at Cornell have said, yes, we found this helpful, and other people said didn't do a thing for me.
Yeah, I think that's exactly what we find in a lot of these different types of therapies.
Yeah.
So Glenn, it looks like Elizabeth would like you to comment on methylcobalamin
Yes.
versus cyanocobalamin.
Yes, something I happen to know a lot about, although I have to actually thank Rose Fleming for bringing my attention to this. Both of those are forms of B12. And what you guys should know about B12 is that deficiency in B12 is probably underdiagnosed. In fact, they say in older people, if they seem to be showing symptoms of dementia, you really should check their B12 levels almost immediately, because it not only has effects on the peripheral nerves, but on the central nervous system as well. And it's simply because the cobalamin molecule, which has cobalt in it, that's why it's called that, is probably the largest molecule that the body normally uses day to day for nutritional purposes. So it is very, very easy to interfere with its absorption. In fact, for people who take B12 supplements, they'll usually tell you take it at least 2 hours after a meal or an hour before, simply because you don't want to get it caught up with the digestion of food and block it entering the bloodstream. But there are some people who have mutations in the methylation process. And I mean, I could certainly spend 20 minutes boring you with the chemistry, but I won't. Suffices to say that many of these B vitamins need to be methylated. They have to have a chemical methyl group attached in order to be in a usable form in the body. Some people don't do this very well for genetic reasons. Those people, I tend to recommend they take already methylated cobalamin. And besides, the other form you notice is cyanocobalamin. Cyan is short for cyanide. You don't want those cyanide radicals running around in your body anyway when your body's trying to convert it to methylcobalamin form. So, I basically tell people, if you have any doubt at all, because cobalamin's not that expensive, fortunately, use the methylcobalamin form. And most online sites, and many, stores do have methylcobalamin form of B12, and you don't have to grab the cyanocobalamin form, just in case.
Thank you. Okay, looks like we've gone through all the questions. Oh, let's see. I think that's it. Okay.
There's another thing in the chat about intense pain only occurs at night or when napping. Yeah, it's a common observation I've found over the years, that people say their pain gets worse at night, or it gets worse while sleeping, and it's less in the morning. It's certainly not the only presentation, though. A lot of us have pain 24/7. It may have something to do with circulation. It may also have something to do with distractibility. If you're in the middle of your life, in the middle of the day, you might be in pain, but not noticing it quite as much.
Yeah. And that's my experience. I can tell you that's my experience. I see in the chat also where we have someone asking about Dr. Hammock. And as you see research regarding neuropathy pain medicines, Dr. Hammock is going to be presenting, or one of his associates will be presenting an update at our annual meeting in May. So stay tuned for that. And I've already been in contact with Dr. Hammock, and he will be following up with a presentation during the May annual conference. Okay, down to below. So here's one from have injectable liquids, which is cyano B12, not methyl. So, but you already have actually answered that, I think.
Yeah, cyano's a bit cheaper, which is why, like the physicians, if they're giving you a B12 injection, they'll go for it. But it's not that much more expensive to get methyl B12. And you probably, by the way, can get just as good an effect with tablets taken each day. I have methyl B12, 1,000 micrograms, which is 1 milligram per day, which I take, and it's basically $8 for a 90-day supply, which, given what, other drugs and supplements cost, is nothing. Yeah. So you may be able to actually get a similar effect with that. And, it's good not to be a pincushion that often as well.
I agree. Okay. I think we've gone through everything. First, again, I want to say thank you very much for participating in this presentation. And again, I want to thank Dr. Donovan for taking the time and expertise to put together the PowerPoint with all the information relative to, neuropathies in general and therapies and causes and diagnosis, et cetera. So again, remember this presentation and all the answers and questions will be recorded and put on the website. So if you have missed something, please make sure that you go to the website. Like, for example, you want to check out some of those meds that Dr. Donovan put into the presentation, do that. And that way you can get a lot more information, as well as many other webinars that we've done in the past. And I think you'll find that some of them will help you and some of them won't. But we want to encourage you to participate by looking at the website and looking at those videos. Again, thank you very much. Thank you, Glenn, for co-hosting and helping with all the questions there. Your answers were excellent and very well knowledge, and we appreciate it. Again, thank you, and everyone have a great day.
Yes, everyone, thank you for coming. Hopefully we'll see you again.
Okay, take care.
Okay. Bye-bye.
Bye-bye.